to kickstart today and will be aired live on KTN News from 6 p.m. to 10 p.m. Dr. Mercy Korir will inform us about what to expect during this forum that seeks to influence new ways of doing things by giving as many Kenyans as possible the opportunity to contribute to the debate on national development, this time round on health matters. Let's take a short break right here on KTN. We'll be back with plenty more as we continue informing you about the latest developments. My name is Jesse Rogers. Do stay with us.
This is KTN News.
I'm having a good time, a shooting star leaping through the sky like a tiger. I'm gonna go, there's no stopping me. I'm burning through the sky, yeah. 200
With over 500 flights every day, Emirates brings the world together through Dubai. Fly Emirates for a world of good times.
I'm having such a good time.
Why does the moon only come out at night?
So that it can sing you a sweet lullaby.
And stars?
They make sure nothing disturbs your sleep.
Then why do these mosquitoes come?
Then let's teach these mosquitoes a lesson, because Mama has Mortein Doom, which makes mosquitoes go away and not come back the whole night. So you get a peaceful night's sleep all night long.
Mortein Doom. A peaceful night is a Mortein Doom night.
We all have an important role to play in the change that we want to see in our society. That is why the Standard Group, together with our partners, brings you Transform Kenya, the platform to help raise your voice and be heard.
Upande wa afya kwa sisi watu wa chini, kama sasa Simon upate ajali, vile tuko naanza na pikipiki upate ajali, ukienda kwa hospitali yetu tunabaguliwa sana, hatushughulikiwi. Unaweza kaa hapo, unaweza enda hospitali leo, uende utibiwe kesho. Kama wewe ni mtu ulikuwa unakufa usiku, unakujanga kuona kwa sasa hivi umeshakufa. Wanatubagua sana.
You go to a public health center and you will get no medicine. You will get very poor treatment, so to speak. It is not a sector which has been covered since independence.
When students enter, like in first year, you pay for help. But when somebody is sick, when you go there to seek for that medical attention, they only give you the Panadols, painkillers. Yeah, so it's not that good. It's not good.
On the 6th of September 2018, we'll be live on KTN News from the Strathmore Business School from 6 to 10 p.m. as we discuss healthcare. Be a part of the conversation on our social media platforms and help build a healthier, stronger and vibrant nation. Transform Kenya. Empower our nation.
You always win, win, win.
I'm so broke.
I'm so broke.
Then win. Get rich with Lotto Jotto. There's 25 million shillings to be won. Today, get your ticket. Send 50 bob only to paybill number 298899. Account Jotto.
Win with Lotto Jotto.
Join us as we talk about the health system and healthcare in Kenya. Learn more about leadership and governance, health and financing, human resource for health, pharmaceuticals and diagnostics, and what universal coverage means to you as a Kenyan. Don't miss it. Tonight, starting from 6 p.m, live on KTN News from the Strathmore Business School. Follow the conversation on our social media platforms and help build a healthier, stronger and vibrant nation. Transform Kenya. Empower our nation. Transform Kenya, brought to you by Standard Group in partnership with the National Hospital Insurance Fund NHIF, Ministry of Health, Cosmos, Jubilee Insurance, Amref Health Africa, the Nairobi Women's Hospital, and Strathmore Business School.
Try Dettol Even Tone. It cleans and helps to reduce the appearance of blemishes caused by oil, dirt and germs, giving your skin a healthy feel. Dettol, be 100% sure.
This is KTN News.
All right, welcome back to KTN News Desk as we continue highlighting various developing stories across the country. Do stay with us. Now, let's switch gears to health now, and we cross over to Strathmore University, where medical correspondent Dr. Mercy Korir is following up the development of Transform Kenya initiative with a focus on healthcare personnel.
Well, thank you very much, Jesse. We are at the Strathmore Business School, and this evening from 6 p.m. to 10 p.m. we'll look to engage you on health issues. You know the President's Big Four agenda. One of them is the health agenda, and there's a push towards achieving universal health coverage. Now, this is a focus of the discussion. This evening from 6 p.m. we shall be looking at different components that encompass the universal health coverage. One, we'll look at leadership and governance. Two, we look at health financing. Third, we look at human resource for health. These are all the healthcare workers, the health personnel that offer us services in the health sector. Fourth, we look at pharmaceuticals and diagnostics and what percentage it contributes to the cost of healthcare. And last but not least, we will find out what universal health coverage is and what it's not. And we know that to achieve all this, and we've seen from the WHO that it needs a country's dedication and determination and definitely the political will. We here at the Strathmore Business School are joined by John Moy. He is the manager of the Institute of Healthcare Management. Here at Strathmore, they train various healthcare stakeholders to be better healthcare managers in the health sector. And there are two pertinent issues that we will discuss. One of them is the human resource for health, that is the healthcare personnel, and we know that they are like the backbone in offering healthcare services. And second, they take a lot of the resources when it comes to the healthcare. These two issues I'd want us to discuss with you. One, we know we have a big shortage when it comes to doctors, to nurses, to clinical officers, to laboratory officers, pharmaceutical technologists. What are we doing and what can we do better as a country to bridge this gap if we are to achieve that goal of universal healthcare coverage for all?
Okay, thank you very much, Dr. Korir. And I think first and foremost is to say that resources are usually scarce, but what is important is innovation that can happen around those areas. I know a lot of discussion and a lot of work is going about task shifting and, trying to make sure that the human resources go closer to the people. But most fundamentally, we have to increase funding that is going to the health sector. Remember the Abuja Declaration that says 15% of our national revenue needs to go to the health sector. That is the only way we are going to bridge that gap so that then we can have enough human resources on the ground that can deliver the services to the people. Mm-hmm. Yes.
And we have had this discussion. There are countries that have managed to reach the 15% Abuja Declaration, where the national cake, 15% of it should go to the healthcare workers. But here we find that our health budget still oscillates between 6 and 7%. We are not yet there. In 2017, we saw a situation where health services were paralyzed, where the doctors were on strike, the nurses were on strike, demanding for this national cake, for those resources. Are we almost getting there in terms of sorting out the human resource so that we can focus on the other components of healthcare?
I would say bit by bit we're getting there incrementally. We can see that over the years. But most importantly is to have the conversation around the stakeholders who are involved, from the people who are providing the services, including the people who are consuming the services, and all other stakeholders, so that we can see how progressively as a nation we can tackle this issue. Even if probably we won't hit the 15%, let's keep making progress day by day.
And we see that as we try to get a lot of more resources into the health sector in order to provide quality, affordable health services, that these monies, these curses are meager. We're not able to achieve, and we end up relying on donors, some of whom are pulling out. How or what can we do as a country to be able to sustainably run our health sector without relying on donor funding or without relying on other stakeholders to fund our healthcare initiatives?
I think this is where institutions like Strathmore come in, because our concern here is about building capabilities in the leadership. It's about leadership, it's about governance. We are leaders, we are managers in the health sector. Can we look for innovative ways of, if it's fundraising or delivering care using innovative strategies? Could it also be maybe we are not competent enough in the way we do our budgets, in the way we do our work plans, and this is where we come. We build capacity among the key stakeholders who are the health service, the healthcare workers, to see whether we can help in bridging in some of these issues. Some of the issues are beyond the health workers for sure, but I think that I will insist again, it's about the conversation and engaging with the relevant stakeholders from the legislature, from the executive, and all arms of government, or all the stakeholders, to make sure we can deliver that.
But many may ask that, well, we're engaging stakeholders, we're having all these discussions. Where are the fruits of these discussions?
Well, I think we keep reaping them. I think one of it is devolution, for instance, where with that the conversation took a bit of time to happen, but finally happened. Now we have services closer to the people. We are not yet there yet, but I have a lot of confidence in the people who are working in the counties, because we interact with them on a day-to-day basis. They are working very hard to make sure that devolution works and services that people needed delivered close to them. And not only services, quality, affordable, and timely, is going to happen to them.
Okay.
Yes.
Thank you very much, Mwai. Thank you very much. And we definitely look forward to a continued discussion from 6 p.m. to 10 p.m. on Matters Healthcare. We will be tackling some of the issues that Mwai and I have just highlighted here in detail. We'll have a panelist that will be able to engage and provide us with details of what we can do as a country to make sure that you are able to access healthcare services that are affordable and quality healthcare services, no matter which part of the country that you are in. Back to you, Jesse.